So today we will talk about two very important matter. One is we have talked about nutritional deficiencies. We have talked about recommended dietary allowances in my last class, and also balanced diet, and we have also covered how much calorie or how much protein or how much minerals and vitamins are there in particular food items, right? After that, along with your family adoption program, you have taken dietary history, and we have taken only one method, which is 24-hour recall method. This method has a shortcoming, a drawback. Okay, that drawback was that it is not uniform for all the family members. Like if there is a child, so his or her requirement will be different. Now comes, it's a very important topic, long question comes from this, how to do nutritional surveillance. Okay, so these are the things we are going to overview. Okay, understand it first, and also you can note down the highlighted points. So it started in Rome, first food conference, that a community, a family, a country has different nutritional needs. State of Tripura has different nutritional needs. West district is different than Sipahijala district. North is different than South and Dhalai. Okay. So as per the book and WHO, what is the definition of nutritional surveillance? To constantly monitor the different changes in pattern and demands of food, so that we can take actions. What kind of actions? So that we can make some planning and programming. Now there are different geographical regions in India, right? The North India is, deficient of rainfall compared to northeastern part of India. So that's why the main food crops in North India are, gehu, wheat, bhutta and all. When you come to mountains and northeastern part where rainfall is sufficient, where you get rice cultivation. But now there are shortage. So food policy and nutrition policy again is changing. So we have to maintain our decisions also. We have to tackle crisis situation. Crisis situation like earthquake, flood, war, migration, lockdown. These are crisis situation. We have to change our policy. That supply of onion is less. What are the essential commodities we should supply to maintain basic nutrition? These are the requirements. So it's a cyclic process. We collect the data, we process it, we see if there is any new need, any new calamity or disaster we have to, encounter. What are the steps of nutritional surveillance? नीचे से शुरू करेंगे. पहले क्या करेंगे? We will see, is there any problem or not? Yes sir, there is a problem. The village where we are going for family practice, all the children are undernourished. So we will collect the data. What data we will collect? हम history लेंगे, Anthropometry करेंगे, measurement करेंगे, mid-arm circumference लेंगे, head circumference लेंगे, weight लेंगे, height लेंगे. Data collection कर लिया, data लेके आगे, now we will process it. After processing we can find किसका BMI कम है, normal parameter से कम है कि नहीं. Then what will do? Interpretation. Now I can tell how many children are undernourished or overnourished, overweight. Then I'll make a plan to improve the nutrition. What can be in the plan? That I can educate the mother कि आप ऐसे खाना बनाओ. I can, approach the district administration that what kind of problem is there? Is there any the water supply is contaminated, and that's why there is waterborne diseases, so nutrition is poor, or there is no road to access the market easily. That's why people cannot go to market, purchase the local food and sabjis and come back to make normal natural food. So the administration or the ADC area administration, they can take after the road. Okay, so there are different things, dynamic things which are connected with each other. Lastly, I can see improvement or decline. मेरा plan fail कर सकता है, and that's how it is implemented. Same thing, what I have discussed. Purpose. When I am talking about health and development planning, the source of data will be household survey. Okay. When I come to timely warning and intervention program, interviews and records, rainfall, prices, employment, health systems, are the different survey techniques. Any national survey? Any national survey Yes? Census, right? It's a national survey. Any other survey do you know? Any name of any other survey? Yes? Yes, speak up. Huh? NRC. Okay, that is also a different kind of survey but not related to health. Okay? NMSS, National Nutritional Monitoring Surveillance Statistics. Okay, NMSS data. What are we going to see? Availability of food, is there or not? अभी food है market में, accessibility है कि नहीं है? Can we access the food? Okay, food composition. There is a body. If you have a packet of biscuit or atta, if you flip it, you will see there is an organization name written in italic font, FSSAI. Okay, so that's a governing body which take controls of all the composition and food adulteration. Then current nutritional status. They will take state health data, whether this population in this particular area, what is the current scenario. Then we have to check what are our backup plans. Now we are going for survey. I need to know how many weapons I have to tackle a situation. You are going to treat a patient after a few years. For that, your weapon is your education, your skills, and your hands-on knowledge. These are the things you are going to take to the field. Okay? Status of KAP with reference. KAP means knowledge, attitude, practice. Your knowledge regarding nutrition, your attitude towards nutrition, and your practice. Okay? Say for example, I know दाल में प्रोटीन होता है थोड़ा बहुत, ठीक है? Not like chicken but थोड़ा बहुत होता है. It is my knowledge. Attitude. ডাল কেন খাবো? আমি শুধু চিকেন খাবো. That is my attitude. Practice. Actually আমার ঘরে কি খাওয়া হচ্ছে? That is practice. Difference समझ में आया? KAP, knowledge, attitude, practice. And lastly, food safety. So we also take dietary intake. ठीक है? যেটা আমরা ফ্যামিলিতে গিয়েও আমরা হিস্ট্রি নিচ্ছি, dietary intake and history, we are going to take that. And same thing. What are the methods of collection of this data? Household survey हो सकता है, sentinel survey हो सकता है, स्कूल से हम डेटा कलेक्शन कर सकते हैं बच्चों का, एंड ग्रोथ मॉनिटरिंग कर सकते हैं. पॉपुलेशन बेस्ड रिपीट सर्वे कर सकते हैं, घर घर जाके, गांव में जाके, फैमिली में जाके, ठीक है. ग्रोथ मॉनिटर कर सकते हैं. नाउ ग्रोथ मॉनिटरिंग इज इंडिविजुअल, एक सिंगल का करेंगे. एंड ग्रोथ मॉनिटरिंग, द मेन पर्पस ऑफ ग्रोथ मॉनिटरिंग इज टू एजुकेट द मदर, to educate the guardian, family member. You are taking the growth chart and you are taking the weight, and you can check that this child is not growing up to his or her age. So next step is educate the mother. কি করে ঘরে অ্যাভেলেবল সবজি শাক ওগুলো দিয়ে ভালো নিউট্রিশাস খাবার বানানো যায়. How to identify early signs of infection. How to identify early signs of poor nutrition so that the child does not land up into hospital. Okay? There is a difference between growth monitoring and nutritional surveillance. Surveillance requires a sample of population. So there will be a bigger number of sample, 30, 40, 50 people, 50 students, okay? They will represent an entire community. or an entire state or country. Whereas growth monitoring is solely dependent on some individual child. ठीक है? And in nutritional surveillance, we are going to intervene. We are going to examine, do some tests, lab tests and all, and collect data. Growth monitoring, we are not going to do that. Okay? And there are many other differences like response time, referral and all. ठीक है? Sentinel site surveillance. Hotspots. Some hotspots like, sir, if I go to Dholeshwar or Bortola, I may not find a community who is poorly nourished. But if I go to that slum area or the migrants or the migrant laborer slum somewhere in Dukli industrial area, I might find a group of people who are living under tents and their nutrition is poor. So those hotspots are called sentinel sites. Now if I do a surveillance there, sentinel site surveillance. And of course, school census data. With the help of all the school teachers, we can take the records. Okay? And many schools have their annual or biannual health checkup and data. Okay? What are the national bodies? Different national bodies which take health system data. National Nutrition Monitoring Bureau is gone now. That is obsolete. Now for us, the most important part is the last one. Sorry, this one. National Family Health Survey. We call it NFHS. Okay? All the data. कि सर कितने बच्चे इस स्टेट में मर जाते हैं, कितने बच्चों का न्यूट्रिशन स्टेट में पुअर है, all the data come from NFHS data, National Family Health Survey. And last class I talked about NIN, National Institute of Nutrition. The headquarter is situated at चारमीनार कहाँ पे है? चारमीनार? Yes? Hyderabad. NIN is in Hyderabad. Okay? NIN has collaboration with ICMR, Indian Council for Medical Research. The guidelines we get, WHO gives us international guidelines. WHO also has an India branch, Southeast Asia branch, and ICMR is our main health body which gives us many. ICMR is conducting short-term studentship, STS, ICMR STS. So students who are interested to get your articles published, to make an article, do some research work, you can choose any one faculty from any department, and the last day of submission of your protocol is 30th of May this year. ICMR gives you grant, monetary grant, so that you can, if you get selected, it will be a national publication and you will get some money also for that. Okay? Going forward, this is NIN, historical picture. Objectives now are clear, that it collects data. ICMR and NIN are collaborating organizations. So how are you going to do nutritional surveillance? Viva question. Surveillance करेंगे कैसे? How are you going to do nutritional surveillance? Family में जाके क्या करते हो पहले? You take history. Child birth कैसे हुआ था? Normal delivery हुआ था कि cesarean section हुआ था? After the birth of the baby, whether the baby cried or did not cry. Prelactal feeding practices, whether honey, sugar, everything, all those things were given before breastfeeding, or breastfeeding was initiated very early. Whether colostrum was given or not given. Whether the baby was kept under blue light due to jaundice or not. So history is very important. Whether the child had any infection like diarrhea, sinusitis, pneumonia, whether the child is properly vaccinated or not, history is very important. Then you go for general physical examination. You take temperature, pulse and all. You do head to toe examination. You see whether there is any congenital anomaly is there or not. You see any signs of vitamin deficiencies or not. If you see the eyes, you can check vitamin A deficiency, bitter spots and all. If you come towards the lips and all, you can see vitamin B2 deficiency or not. You examine the tongue, again riboflavin deficiency, chalosis, glossitis are there or not. ঠিক আছে? Vitamin D deficiency, rickety rosaries on the costochondral junction, pectus, carinatum, these are there or not. ঠিক আছে? So, and then another important thing is anthropometry. Now you know what is anthropometry. So weight, height, length and mid-arm circumference. For adults, estimation of blood pressure is important. Again, blood glucose. We have gone through this. NSSO, National Statistical Survey. Okay, it's a body, again, it also under Department of Statistics. I think the mic is working, okay. So again, same thing, all the data it collects. Most important, National Family Health Survey, NFHS. ঠিক আছে? You see there are funding from international agencies. You know about Melinda Gates? Bill Gates, you know? Bill Gates, he was one of the richest men in the world. His wife Melinda Gates. So they donate also in this particular organization for these statistics, okay? And also you have UNICEF, UNFA and all. 1992, first NFHS. And now we are going for NFHS 5. It is done. 2021 was the last NFHS, NFHS 5, okay? What are the components? क्या क्या देखेंगे हम NFHS में? घर में कितने मेंबर है, इनकम कितना है, सोशल स्टेटस क्या है, न्यूट्रिशनल स्टेटस क्या है, बच्चे कितने हैं, ऑल एवरीथिंग डेटा सब कुछ जाता है. कितने बच्चे मर गए, कितने एबॉर्शन हुए घर पे, कितने लोगों को टीबी हुआ, each and every detail goes to NFHS survey and you get a beautiful data. ठीक है, at the end of it, and this is a data you see. What is the most striking thing in this picture? Stunting, matlab height is less according to the age or length is less according to the age, and we are toppers. Our state is topper, right? We have ranked 1 in stunting. हाइट कम हो रहा है धीरे धीरे, सिकुड़ रहे लोग. आफ्टर 5 years इतने बड़े बड़े मेडिकल स्टूडेंट्स आएंगे. हाँ, ऐसे इतना इतना डेस्क काट के डेस्क छोटा करना पड़ेगा. ओके, सो दिस इज, ये ट्रेंड है. व्हेन वी टेक डेटा ऑफ 5 to 6 years and 7 years and we plot, we can see trend. Okay. See again, anemia in last 5 to 6 years, from NFHS 4 to NFHS 5, in between 5 to 6 years, hemoglobin has again declined and Northeast is again in that region. There is very little bit of improvement in overweight, underweight and undernutrition. Okay, the yellow one is the NFHS 4 data and the blue one is NFHS 5. Okay, so little bit improvement is there. ठीक है? And who are the teams that we are going to take? We are going to take field staff, we are going to take, health inspector, we are going to take somewhere who is a surveyor. ठीक है? Emergency situations or when you have no time, like family adoption program, you have only 1 hour, or emergency situations like COVID, migration, war, you have to get the data collection. Can you reduce the echo कमिए दे ना. So That time, how are you going to do? What you do in field? Anthropometry. The easiest method is anthropometry. थोड़ा बहुत history. No. अरे sound. लेने के लिए बहुत कुछ है. But our objectives has to be very clear. What are you going to measure? Target site area. Our area must be defined. कौन से population में करेंगे? कि सर 5 साल के नीचे वाले बच्चों का करेंगे. सिर्फ प्रेग्नेंट महिलाएं मिल जाए तो उन पे करेंगे. तो our population has also be very precise. And of course we need logistics. टेप चाहिए, weight machine चाहिए. What are the information? Rapid assessment के लिए medium circumference. Medium circumference is applicable for, yes, which age group is eligible for medium circumference? Within 5 years, but must be more than 6 months. 6 months to 5 years. Medium circumference is eligible. ठीक है? Less than 6 months किंतु eligible नॉय. And बाकी details, environmental history. These are some extra information. When is National Nutritional Week and when is Nutrition Day? So, what do we need? The gist of this part, we are halfway through today's lecture. So, nutritional surveillance से क्या याद रखना है तुमको? First of all, what is the need of nutritional surveillance? First thing, what is the purpose? What are your objectives? You have to select indicators. Indicators like weight for age, height for age, height for length, mid-arm circumference. These are called indicators. Standardized procedures. हम मीडियम सर्कम्फरेंस मेजर करेंगे तो कारपेंटर वाला टेप यूज नहीं करेंगे, टेलर वाला टेप यूज करेंगे, आइडियली शाकिट्स टेप यूज करेंगे. दिस इज कॉल्ड स्टैंडर्डाइज्ड प्रोसीड्यूर. एंड लास्टली डाटा एनालिसिस. सो कंक्लूजन, it gives timely information. If we collect the data, it will give us information. We can process it and we can plan. ठीक है? We are going to next part. Surveillance वाला चलाओ. Rehabilitation. Sorry. What do you see in this picture? Spot diagnosis. Scarce hair. Hair color has become light due to melanin production has gone decreased. Sunken eyes. Skin loosened. So this is protein energy malnutrition. Along with there are multiple minerals and vitamin deficiencies. Now you have done surveillance. You know what are the deficiencies. You know what should be exact intake. Now what you will do? सर पूरा डेटा कलेक्ट कर लिया, अब मुझे पता है इस गांव में 10 बच्चे अंडर न्यूरिश्ड है, सो इनको ट्रीटमेंट करना है. इनको कैसे ठीक करेंगे? हाउ आर यू गोइंग टू ट्रीट दोस चाइल्ड नाउ? व्हाट शुड बी योर प्लान ऑफ एक्शन? दैट इज कॉल्ड न्यूट्रिशनल रिहैबिलिटेशन. ओके, सो ये कहाँ पे होता है? न्यूट्रिशनल रिहैबिलिटेशन सेंटर पे होता है. NRC, not the political wala NRC, Nutritional Rehabilitation Center. And it is a unit for restoring severely acute malnourished child. We call them SAM. Have you seen SAM? That child was a SAM child. Okay, so we are very fond of asking MAM and SAM. MAM means last class में बोला था MAM, MAM, moderate acute malnutrition, and SAM, severe acute malnutrition. तो कैसे आइडेंटिफाई करेंगे? क्राइटेरिया क्या है? NFHS 5, Stunting, लिटिल बिट डिक्रीज, वेस्टिंग डिक्रीज, लेकिन ओवरवेट बढ़ गया है 3.4%. ओके, एनीमिया बढ़ गया है, especially girls, they are mostly anemic. Immunization has increased. And we had so many national programs, Pradhan Mantri Matru, Vandana Yojana, Poshan Yojana, Anemia Mukt Bharat, this and that. But improvement is very little bit. Because Global Hunger Index, our rank is, भूखल लोगों में हमारा रैंक 111 है. ठीक है, तो हम बहुत पीछे हैं. We have lot of problems. So the objective of NRC is to clinically assess the child, diagnose the problem, give support and improve the nutritional status so that the child can survive and lead a beautiful life. ठीक है sir? What are the services provided in NRC? 24-hour IPD service for those children. Referral service? No. यही है referral center. NRC itself is a referral center. बड़े बड़े institutions, tertiary care centers, medical colleges refer those child to NRC when they diagnose them. ठीक है sir? Now, nutritional support, education of the mother and parents, demonstration and practice by doing the preparation of energy dense child food. How to prepare energy dense, protein dense food at home is taught in NRC. So it's kind of an educational center for the mothers and caregivers. And of course, follow up of children discharged from facility. कौन काम करता है NRC में? एक डॉक्टर रहेगा, मेडिकल ऑफिसर, एक नर्सिंग ऑफिसर रहेंगे, काउंसलर रहेंगे, कुक चाहिए होगा खाना प्रिपरेशन करने के लिए, हेल्पिंग स्टाफ चाहिए होगा, कभी कभी डेटा एंट्री ऑपरेटर चाहिए होगा कंप्यूटर में डेटा एंट्री करने के लिए. ठीक है, अटेंडेंस चाहिए, साफ सफाई करने के लिए लोग चाहिए, बेबी सिटर भी चाहिए. ठीक है, एंड ऑफ कोर्स द लास्ट वन इज वेरी इंपॉर्टेंट, मेडिकल सोशल वर्कर. MSW is a separate designation and they are qualified in sociology. And NRC are 10 bedded IPD. ठीक है, पेशेंट केयर एरिया होना चाहिए, बच्चों का खेलने का जगह होना चाहिए, फूड प्रिपरेशन प्लेस हैज टू बी देयर, किचन हैज टू बी देयर. ठीक है, NRC should have it is not like a ordinary hospital. NRC must have a child friendly setup, okay, where the child can grow, attached toilet facility and all. ठीक है. So what are the criteria to admit a child in NRC? When are you going to admit a child in NRC? Of course when the child is diagnosed with SAM. SAM कब बोलेंगे? Yes, सीवियर तो मेरे को भी पता है, एब्रिविएशन का पूरा फॉर्म बोल दिया, बट क्राइटेरिया क्या है? व्हेन आर यू गोइंग टू टेल कि ये बच्चा सैम है सर? आपने वेट लिया फैमिली में जाके, वेट लिया, हाइट लिया, फिर वेट फॉर एज अगर रेड जोन में गिरता है मतलब लेस देन 3 स्टैंडर्ड डेविएशन. क्राइटेरिया, एडमिशन क्राइटेरिया इन NRC, मिड आर्म सर्कम्फरेंस लेस देन 11.5 सेंटीमीटर, रेड जोन में पड़ जाएगा. शाकिर स्टेप याद है? ग्रीन, येलो, रेड. इफ इट इज फॉलिंग इनटू रेड जोन दैट इज -3 स्टैंडर्ड डेविएशन. देन बाइलेटरल पिटिंग एडिमा, दोनों पैर सूजे हुए हैं. इफ यू टच द फीट्स योर बोथ फिंगर टिप्स विल गो इनसाइड. सो edema is there due to osmosis. All proteins has gone through urine. So now the body do not have protein, less protein, osmosis, body fluids going into extracellular spaces. So bilateral pitting edema and severe clinically visible wasting. If someone does not have muscle at all, like that child in the first slide, you can see there is only skin and bone. So it is physically visible. That is the admission criteria. Admission criteria for 6 months to 60 मंथ मतलब 6 महीने से 5 साल की उम्र के लिए एडमिशन क्राइटेरिया। और क्या क्या देखेंगे? If there is anorexia, if there is hypothermia, okay, if there is signs and symptoms of sepsis, infection, baby is not alert, unconscious, convulsions, so these are the criterias. और क्या क्या है? Severe anemia. If you do capillary refilling time test by pressing the forehead of a baby, press it, remove your thumb, you will see it's a white patch. Press on the sternum on a neonate and leave it. If you see it is blanching completely and it is not getting red again within 3 seconds, then severe anemia. If the baby has jaundice, you will see yellowish blanching. Okay? Then severe pneumonia, chest X-ray is showing high congestion, so admit करना पड़ेगा। 6 महीने के नीचे बच्चों को, दूध पीते बच्चों को एडमिट करेंगे क्या? कब करेंगे? उनमें तो सर मिडम सरकम्फरेंस भी नहीं लेते हैं। तो क्राइटेरिया क्या है? विजिबल सीवियर वेस्टिंग, बाइलेटरल edema of the feet. These are MBBS level knowledge. You do not require pediatrician to get admitted into NRC. These are what you are doing in the field. You are learning that. If you go to family adoption program, you can actually identify whether the child required to be admitted in NRC or not. Okay? This is very basic knowledge. Weight for leg less than 3 standard deviation and infant is too weak. সাক করতে পারছে না, ঠিক আছে, ব্রেস্ট ফিড নিতে পারছে না একদম, ঠিক আছে, ওরকম বাচ্চা। Appetite test. Now what we will see, अभी मैंने इंस्पेक्शन कर लिया, जनरल फिजिकल एग्जामिनेशन भी कर लिया। Now I will see two things, whether there is any medical complications or no complications. Complications like pneumonia, okay, pneumonia, bronchitis, sepsis, jaundice, these are complications. If complication is there, directly send to NRC. If there are no complications, the child is only poorly nourished, do appetite test. कैसे? एक शाम बच्चे को ले जाके, the child should not be fed anything 2 hours पहले तक, and you give some food, pre-mixed food, we call it RUTF, ready to use therapeutic food. ये मिक्स प्रिपरेशन रहता है, पैकेट में मिलता है। इफ इट इज नॉट अवेलेबल, यू कैन मेक इट बाय ग्राउंडनट क्रश, मिल्क, बटर एंड ऑल मिक्स करोगे तो ये बन जाएगा। अभी हम बच्चे को ये देंगे, फोर्स नहीं करेंगे। वी विल ऑफर द फूड टू द चाइल्ड। इफ द चाइल्ड, यस मिस, व्हाट इज RUTF? प्लीज कैन यू टेल द क्लास व्हाट इज RUTF? What am I blabbering for last half an hour? Taking all the efforts to come here and speak something which will, hurt my vocal cords. लिखा हुआ है RUTF, appetite test. Appetite test किसको करेंगे? काके करबो आमी appetite test? তোমাকে আমাকে কাকে করবো? Appetite test किसका करेंगे? हाँ, किसका? बेबीज। क्यों करेंगे? टू सी व्हाट? एपेटाइट टेस्ट के पहले क्या देखेंगे? एपेटाइट टेस्ट के पहले हमने क्या किया? वी वेंट टू द फैमिली, वी एग्जामाइंड द चाइल्ड, we took history, we took 24-hour dietary history, we did anthropometry, we check whether there is any complications or not. If there are complications, please sit down. If there are complications, I will directly refer to NRC. If there are no complications, I will do appetite test. Appetite test कैसे करेंगे? ये खाना देंगे, ये प्रिपरेशन देंगे, उसके बाद I need a separate room, I need this ambience where I will offer the food and I will not force the child to have the food. Now, according to the birth weight, अगर 3 किलो का बच्चा है, अगर उसने लेस देन 15 ग्राम फूड खाया, 15 ग्राम मीन्स लेस देन 1 टीस्पून, 1 टेबल स्पून, 1 चम्मच 15 ग्राम. If the child takes less than 1 teaspoon of food spontaneously, appetite test fail. 10 किलो का बच्चा 35 ग्राम फूड नहीं ले रहा है मिनिमम, appetite test fail. If fail, admit in NRC. Simple. Now I have shown this slide before also. Now the child is admitted in NRC. अभी क्या करेंगे? पहले कुछ दिन स्टेबिलाइज करेंगे बच्चे को, क्योंकि बच्चे का अभी बॉडी में पानी नहीं है, इलेक्ट्रोलाइट नहीं है, ग्लूकोज नहीं है, तो उसको पहले स्टेबिलाइज करेंगे. स्टेबिलाइजेशन फेज फर्स्ट 1 वीक और 4 to 5 days. So I'll correct dehydration, I'll correct hypothermia, I'll correct hypoglycemia. अभी बच्चा थोड़ा थोड़ा मुंह से लेना शुरू करेगा. Now I'll do rehabilitation phase. Suppose you see a bird in your hostel who is dying and you took the bird to your room. What will you do in the first 2-3 days? You will give shelter to the bird. You will say whether the wing is broken. You will give a warm cloth to the bird so that the bird survives for few days. When the bird survives, then you start extra feeding. Okay? So in rehabilitation phase, we see catch-up diet. See, catch-up diet F-100 after 3 to 7 days. And in first stabilization phase, starter diet F-75. Okay? Along with that, infection, feeding, and love. Last 2 points. Provide loving care and play. बच्चे फूल जैसे होते हैं. If you do not provide them loving care, all your programs will fail. No matter how much RUTF or F-75 or saline you give, the child will not grow up if the child do not get motherly care. अगर बच्चा ऑर्फन है तब भी अगर NRC के स्टाफ, डॉक्टर, नर्सेस से उसको मदरली केयर नहीं मिलता है, the child will not grow up. Okay? So that is important. These are the 10 steps. This will come as a question. हाइपोग्लाइसेमिया करेक्शन कैसे करेंगे? ब्लड शुगर 54 से कम हुआ तो हाइपोग्लाइसेमिया. कैसे करेक्ट करेंगे? डेक्सट्रोज देंगे. ओके, डेक्सट्रोज 5 ml पर kg डेक्सट्रोज से शुरू करेंगे. हाइपोथर्मिया कैसे करेक्ट करेंगे? हाइपोथर्मिया इफ एक्सिलरी थर्मोमीटर से टेम्परेचर लेस देन 35 डिग्री सेंटीग्रेड. तो व्हाट आर द कॉमन वेज? टीच द मदर कैंगरू मदर केयर. एनीबडी नो कैंगरू मदर केयर? KMC. एनीवन? कैंगरू पता है? कैंगरू अपना बच्चे को कहाँ पे रखता है? पेट में रखता है. सो देयर इज अ मार्सुपियम, देयर इज अ नॉर्मल पाउच. सो दे हैव adopted this formula with lactating mothers कि कैंगरू की तरह अगर मम्मी अपने बच्चे को अपने पेट से लगा के रखेगी और बच्चे का पेट भी मदर के पेट के साथ लगा हुआ रखेगा, मतलब बोथ वेंट्रल सर्फेसेस आर टचिंग ईच अदर, सो द बेबी विल ऑलवेज रिमेन वार्म. फर्स्ट थिंग. सेकेंड थिंग, द बेबी विल ऑलवेज इजीली गेट ब्रेस्ट फीड, ब्रेस्ट मिल्क. उसके लिए भागदौड़ नहीं करना पड़ेगा. थर्ड थिंग, बिकॉज द बेबी इज अटैच्ड टू द मदर, द बेबी विल गेट लेस चांसेस ऑफ इन्फेक्शन फ्रॉम आउटसाइड एक्सटर्नल सोर्सेस. ठीक है? सो दैट इज कॉल्ड कैंगरू मदर केयर. मेंटेन रूम टेम्परेचर भी मेंटेन करना पड़ेगा. AC बहुत कम कर दिया तो बच्चे के लिए प्रॉब्लम होगा. स्मॉल चिल्ड्रेन एंड बेबीज लूज मेजॉरिटी ऑफ देयर हीट थ्रू हेड, क्योंकि उनका हेड सर्कमफरेंस बॉडी से ज़्यादा होता है. एरिया इन द हेड इज मोर देन देयर बॉडी, सो हीट इवापोरेट्स एंड द बेबी गेट्स कोल्ड. दैट इज वाई इन हॉस्पिटल्स नर्सेस क्या करती है? बच्चे को रैप करते हैं, बेबी रैप. एवरीथिंग इज देयर एंड रैप कर देते हैं ना, सिर्फ चेहरा बाहर रहता है. इट इज साइंटिफिक एंड एस्थेटिक. एस्थेटिक नहीं है वो, इट हैज साइंटिफिक मीनिंग. ठीक है? Treatment of dehydration, no need to read this full, but remember you have to take ORS. If the child cannot take ORS, you have to put IV IV saline, preferably Ringal lactate. F-75 and F-100, we were discussing about that. These are oral food. स्टेबिलाइजेशन करेंगे F-75 से, पहले लाइट खाना देंगे. अभी सडनली हॉस्टल में खिचड़ी मिल रहा है गर्मा गर्म, अभी अचानक से मटन बिरयानी, गोश्त, तंदूरी, कबाब ये सब आ गया, ये खिला के क्लास में भेज दिया, तो 10 स्टूडेंट्स में से 3 स्टूडेंट्स का डायरिया हो जाएगा. बिकॉज योर डाइजेस्टिव सिस्टम इज नॉट रेडी फॉर दैट. दैट इज वाई लाइटर वेट का मॉलिक्यूल पहले देंगे, F-75 देंगे पहले. ठीक है, उसी कंपैरिजनली यहाँ पे लेस पोटाशियम है, यहाँ पे लेस सोडियम है, लेस मैग्नीशियम है, सो इट इज लाइटर, लेस कैलोरी. अभी बच्चा मुंह से खाना शुरू कर दिया है, अच्छे से खाना खा रहा है, ठीक है, एपेटाइट अच्छा है. नाउ आई विल गो फॉर F-100, हायर कैलोरी, हायर प्रोटीन, हायर मिनरल्स. बच्चा शॉक में चला गया तो अगेन IV फ्लूइड्स एंड ऑल. ठीक है, आई एम नॉट गोइंग इनटू टू मच डिटेल्स इन शॉक. इन्फेक्शन हुआ, ऑब्वियसली आई नीड एंटीबायोटिक्स. सिर्फ खाना दे के फायदा नहीं होगा, आई हैव टू करेक्ट इन्फेक्शन. इफ देयर इज इन्फेक्शन द बेबी विल नॉट ग्रो. विटामिन डेफिशिएंसीज, मिनरल डेफिशिएंसीज, वी हैव ऑलरेडी टॉक्ड इन लास्ट क्लास. साथ में you start with supplementation of vitamin A, age-wise, folic acid. But remember, packed question, during stabilization phase, we will not give iron. यहाँ पे लिखा हुआ है, iron is given after 7 days. Iron supplementation is only given after 7 days because the baby will not be able, the child will not be able to tolerate iron and it will vomit. Sensory stimulation, लाड, प्यार, दुलार. Allow the baby to play, allow the baby to see colorful pictures. Otherwise, the nutrition will not get absorbed. Otherwise, the baby will not grow. There is a question called Baby Friendly Hospital Initiative, short note. So these are all included. Cheerful environment helps the baby to grow. That is why children hospital में कलरफुल पिक्चर्स लगा हुआ होता है, वो बोरिंग वर्ड की तरह नहीं दिखता है. Am I audible without the mic? माइक से तो आवाज गूंजता है. ओके, स्ट्रक्चर्ड प्ले थेरापी, 15 to 30 मिनट बच्चा खेलेगा, उसके बाद डाइट देंगे, बच्चा सोएगा. दिस इज द रूल. रिहैब. नाउ बच्चे को डिस्चार्ज भी करना पड़ेगा. हॉस्पिटल में एडमिट तो नहीं रखेंगे पूरी जिंदगी. डिस्चार्ज क्राइटेरिया क्या है? ट्रीटमेंट कर दिया, अभी डिस्चार्ज करेंगे. डिस्चार्ज क्राइटेरिया 3 दिन कंटिन्यूअस 5 ग्राम पर केजी बॉडी वेट अगर इंक्रीजिंग है, इडिमा रिड्यूस हो गया, बच्चा खेल रहा है, खाना टाइमली ले रहा है, तो विल डिस्चार्ज. ठीक है, ब्रेस्ट फीडिंग अगर ठीक ठाक नहीं है तो मदर को काउंसलिंग करेंगे. ठीक है, मदर ही नहीं है तो दूसरा सब्स्टिट्यूट मदर देखेंगे. इन हॉस्पिटल्स इफ वन मदर is lactating one baby, sometimes the other baby is also kept along with her so that she can breastfeed 2-3 babies at a time. This is called supplementary breastfeeding. Okay, supplementary suckling technique. Now the baby is sucking the breast, but baby is undernourished and baby is more than 6 months old. So what they have done, there is a small tube with supplementary feeding which is attached to the breast and it is also directly going along with the nipple inside the baby's mouth. So when the baby is sucking, that baby is getting extra nourishment. You got it? Discharge criteria. Edema खत्म हो गया, signs of vitamin deficiency कम हो गया, skin turgor, मतलब if I pinch the skin and leave it, तो ये जल्दी चला जा रहा है. In a malnourished child, it will not go. It will remain there for 2-3 seconds and then it will slowly go. Consecutive days, more than 5 gram per kg body weight is increasing. Okay, immunization is updated. This is the discharge criteria. And mother knows how to make food. Mother knows how to identify infection. That is another criteria. Weight gain formula, I'm not going into that. Follow up. दोबारा कब बुलाएंगे उसको? 10 दिन बाद, 2 weeks, 1 month and 3 months. Okay? To see whether the child is catching up or not. And there are healthcare workers, we give some incentives under national program. एक बच्चे के लिए 100 रुपए 200 रुपए like that, and ये change होता रहता है. See, this is a child that was during admission and that was during discharge. गोलू मोलू हो गया ना थोड़ा. So multiple things. Remember, when it comes to nutrition, only food will not help. You need to prevent infection. Best way, vaccine. अभी हो गया है तो antibiotics. Most important pillar, mother. Without mother's education, your entire program will fail. So these things must be remembered. Okay, that is our target, global target, to reach zero hunger by 2030, sustainable development goal. That is worldwide goal. Okay, so anyone who is interested for STS, you can reach out to the department. You can choose a faculty of your own choice. One student, one faculty. That is the criteria, and how to do it, faculty will guide. Last day is 30th of May. Okay. Thank you.